We're going to be talking about POTS, postural orthostatic tachycardia syndrome, and neuroplasticity. I understand, right? You've got the common symptoms of POTS: chronic fatigue, headaches, dizziness, lightheadedness. Maybe you're passing out or feeling faint. You may even have gastrointestinal based issues, heartburn, diarrhea, constipation. Maybe you've got overlapping things, right? Ehlers-Danlos syndrome, autoimmunity, and other things like that. Now, you're trying to get the diagnosis, right? So they're looking for your heart rate to go up greater than 30 beats per minute if you're an adult when you go from laying or sitting to standing. And if you're a teenager, it's got to be greater than 40 without a drop in blood pressure. I do understand there's some of you who are having significant drops who are still being diagnosed as POTS plus orthostatic hypotension, and that's okay. I'm not here to necessarily argue that. But when this happens, what occurs? Well, you get diagnosed with POTS, and you kind of get pushed back and forth between cardiology and neurology. The neurologist doesn't want you because they're like, well, I really didn't get any training in this. We didn't really recognize POTS back when I was in school and residency. And so it gets pushed to the cardiologist. They're like, there you go, man. It's a heart rate issue, right? POTS is a heart rate issue. So we're going to send you to cardiology. And then cardiology is like, crap, you gotta be kidding me, right? So, they're just like, well, you've got this, so let's get you propranolol because your heart rate's going way too high. So that's going to get it down. And as long as you don't have orthostatic hypotension, you'll be okay here. But if you do, maybe get this, plus you're getting fludrocortisone, you're getting metadrine, right? You're getting something to help that. And then you're also told to increase your salt intake, to wear compression stockings, and then honestly to go and do physical therapy, and you're going to push. Now, if you're watching this video, that means that approach has completely failed. And it's honestly going to fail for most, okay? So when we look at this, we need to realize that POTS is not a cardiovascular-based disorder. It is a cardiovascular-based manifestation. Okay, so you see the issues with your heart rate as a result of something else. So it's manifested there, but this is not the underlying cause. If it was, it would actually respond much better to the treatments than it does. So what is it exactly? Well, when we look at POTS, POTS falls underneath the family of dysautonomia. Okay, autonomia, autonomic nervous system. So we're going to put NS, nervous system. So dysfunction of the autonomic nervous system. So you've got your parasympathetic, sympathetic. Now this should be shifting back and forth, right? Yes, we're typically more parasympathetic than sympathetic, but we're never necessarily all or nothing. So we're really shifting. So this is a problem there, and that's why we're talking about POTS and neuroplasticity, because neuroplasticity is the brain's ability to change and connect. So it's really to change, let's put learn, right? Because when neuroplasticity is positive, it is strengthening good connections that you want strengthened. But when neuroplasticity is negative, guess what? You can also strengthen bad connections that you don't want to reinforce, but that can happen too. And if this is making sense, I'm about to help you go a little bit further, because this is a nervous system based disorder. And when we look at the brainstem, okay, we've got the brainstem, we've got the cortex, you've got this top part here is known as more as sympathetic. This part here, right, is known more as parasympathetic. The brain, the cortex, fires down to your parasympathetic areas primarily. From here, it fires down to the rest of the body to control your heart rate, to control your blood pressure, to control your intestines, to control, right, your spleen, all of that stuff. But then it also falls up here to keep your sympathetic nervous system in check. Now, one of the things that people talk about in neuroplasticity is they will talk about right here, you've got what's called your vagus nerve. So this is kind of all the hype the past couple of years. Well, before his hype, we were still doing it. So vagus nerve is actually what helps to regulate all of these. Now, these nerves, they do both. They send information and they receive information. So for example, let's say you go from sitting to standing, right? Or laying to standing, and your blood pressure drops too much. Well, here's one of the things that's happening. You have what are called baroreceptors. Okay? These sense pressure changes, pH, and other things within your arteries. When the baroreceptors, guess what? When there is a lot of pressure against them, they say, oh, let's fire into the brain, right? We're going to send input into the pontomedullary area, to the medulla and others, and towards the vagus. And we got too much pressure. Let's tell it to, let's relax, and let's open up the blood vessels a little bit more, right? But then you have the other side, where you do not have as much baroreceptor response as you should. So baroreceptor response goes down. What should happen? You should constrict your blood vessels. As a result, your blood pressure goes up if you're not doing anything, but when you're standing, it really just kind of maintains your blood pressure. So for those of you that have orthostatic hypotension, this is, once again, it is a neuroplasticity issue because of baroreceptors are not responding and sending information there appropriately, or they are responding and there's dysregulation here in your pontomedullary area with your vagus nerve, and that's impacting you. Now, this does not mean that this is so simple as, oh, I just do some basic vagal nerve stimulation. Now, don't get me wrong, we do have different devices that help with vagus nerve stimulation, but vagus nerve is definitely not the only thing we are going after. So I hope this is making sense. Now, as we look at this, right, when we look at neuroplasticity, this is not the only thing that lives in this area. Okay, so you have multiple cranial nerves throughout your brainstem. You also have what's called your cerebellum. Now, there's a lot of you who have dizziness, and the more severe ones, you can't even move your head like this without getting dizzy, right? You can't drive, anything like that. So you have here cranial nerve number 8. Okay, this is your vestibular nerve. Now, your vestibular nerve connects to the inner ear, and it sends information back, right? So this is your peripheral component. And then you have a central component. Unfortunately, the vestibular system is widely discounted in healthcare and poorly talked about, to be honest. The vestibular system is talked about as if it's just a peripheral-based thing with inner ear crystals, and so they're looking for you to have vertigo where things are truly rotating. Most people, in my experience, they don't really have that, but they do have central vestibular-based issues. So, and your vestibular system feeds into your cerebellum feeds back to regulate it. But the other thing is, your vestibular system, guess what? There's vestibular autonomic reflexes. So when you're bending down or you're doing movements like that, your vestibular system helps to feed into your autonomic nervous system to maintain proper blood pressure. And if you can't, now blood pressure goes off, you can also get heart rates going to increase, and it's not going to be what you want it to be, right? You're going to feel bad. But our vestibular system also doesn't live in isolation, right? So we know the cervical spine actually can fire into the vestibular system as well and to help modulate it. So this is where I beat up this group all the time. Yes, I'm both a chiropractor and a nurse practitioner, right? But I've done neurological work for well over a decade. And they'll say, oh, well, you adjust the cervical spine, everything's going away. Well, that doesn't mean they don't help anyone, because they clearly do help some people. But it does mean they're hoping addressing the cervical spine fixes everything else, and that's going to have a low degree of success. And we like predictable results. And that's why we don't put all of our eggs in one basket for the cervical spine, right? They'll be like, oh, but you've got your cranial cervical junction, you know, you got your C1, C2, this is off, this is what's doing it. And once again, that's overly simplistic. Most people that I've talked to do it. Obviously, they got better from it, they probably didn't come see me. But I've had lots of people who've either had zero results from it, brief-lived, and that's it. Because this does fire and help modulate. But that's not it. Only you also have your visual system. Also fires into your vestibular and interacts, right? So you've got your eyes here, right? You've got your cranial nerves, 3, 4, and 6. This is playing a role in your eyes, right? So you may notice when you're shifting your attention and you're in a group of people, you're trying to drive, you are on the computer too much, you start feeling really, really icky. Well, once again, the visual system impacts the vestibular system. So I hope you're starting to understand the concept of neuroplasticity. And this is one of the reasons why when I bring people into my office and we do vestibular testing, we do balance testing, we do computerized eye movement testing, video oculography, I'm finding 75% of people are going to bomb this test. And if this isn't done, then you will never get to where you want to be, in my experience. It's just not going to happen. So this has to be done. Now, this does not mean that just because you have an issue here, this is going to be 100% of what you need. Let's be clear. That's not what I see either. I see that for about 25% of my patients. That is all they're going to need. But the others, they need a combined approach. Now, you may be wondering, well, what do I mean? Well, because we've been talking about neuroplasticity from evaluating the visual system, the vestibular system, balance, the cervical spine. But neuroplasticity is the brain's ability to connect. So you can have connections within your brain, but you can also have inflammation or immune-based issues that impact neuroplasticity negatively, right? So if you notice in your menstrual cycle, your POTS gets worse. If you notice you're getting sick frequently, your POTS gets worse. If you notice you've got bad allergies seasonally, POTS gets worse. You notice you have certain foods that you eat, your POTS gets worse, right? This also impacts neuroplasticity. But then on the other side, you have a, let's just call it energy, aka mitochondria, right? Based. Now, maybe you've got some hormone issues. Maybe you have anemia. Maybe you have thyroid, right? And really, there's other things that we can put down here. This also is going to ruin neuroplasticity and make it negative, or it's going to support neuroplasticity depending on where you're at and how well this stuff is controlled. Now, you may be thinking, this is really, really nuanced. And you're right, this is nuanced. This is why you're not getting better. If this was simple, guess what? Everyone would be successfully treating POTS. But yet, I get people who've been dealing with it for 5 years, 10 years, 15 years, and they come in and we're finally able to help them get answers. But it's because you have to blend your understanding of cardiology with neurology, with immunology. If you only are trying to do one and ignoring the rest, in my experience, the results, they just simply are not there. So I hope you're really understanding this is the framework. It is neurology plus immunology is how you get positive plasticity with POTS. So now all of a sudden, you don't have chronic fatigue, you don't have headaches, you don't have dizziness, word finding issues, mood changes, and all that other stuff that you don't like. So I hope you really understand this concept and this framework of how this should be approached, and ultimately this is how it should be treated, right? Let's also put gut health in here for the inflammation and immune side. But there are a lot of factors at play. Someone tries to reduce it down to one thing, they're going to have a really, really low success rate. POTS is just not that simplistic. And I understand there are going to be those of you who are like, oh, I've watched this whole video. What do we actually do to fix it? Once again, it is a combined neurological and immune system based approach. You've got to work through this framework. It's got to be cervical spine, vestibular system, oculomotor system, your visual system, right? All of that has to be looked at. But you also have to look at in-depth labs, right? I'm not talking about the $20 labs that they keep doing on you. And they're like, oh, it's normal, it's normal. The amount of times I get people who are told their labs are normal, and then we just do an expanded panel, and all of a sudden there's a ton of stuff that shows up. And it's not because these are worthless markers. It's because these are things that truly matter. And they just come, honestly, they ignore. They ignore. Let's just call it what it is. So this is the approach that I've seen helps get so many people back to where they want to be, right? Most of my POTS patients, 80, 90% better. Are there some who didn't get back to that level? Yes, right? Because there's other things going on. But most do really well when we start identifying what's happening. We identify the patterns. The more patterns that we can identify, the better off you're going to do. For example, let's say you're studying for a test. If you only study 25% of the test material, you're probably not going to do very well, right? Because you have to hope they ask very biased from that part that you've actually studied. But that's what happens. You're going to providers who are like, oh, I do this IVs. I'm this supplement person, or, oh, I'm just hyperbaric, or, oh, I'm just this. And you're trying them at different points in time, and you're like, but it's not working, and I've done it. Well, but yeah, but you studied something, and then you took the test, and then you came back and you studied the other part of that chapter after the test was already done for a new test. Like, no, you have to do it at the same time. And it's not that you even need all those at the same time, right? Or that you need them all in general. But the more data points, the better the evaluation you get, the greater certainty that you can actually get your life back. So I hope you found this highly useful. I do have other videos where I actually show you examples of eye movement tests, balance testing, and other things like that. So next time, I'm Dr. Z. I'm known as the Brain Guy, and I do see patients who fly in from other states for this type of unique special care that we're delivering right here in Wesley Chapel, which is a suburb of Tampa,